Welcome to Bench to Bedside, a weekly series of live conversations about recent advances in cancer, from the research bench to treatment at the patient's bedside. And now, your host and the director of the University of Kansas Cancer Center, Dr. Roy Jensen.
Hi, I'm Dr. Lori Spivak, gynecologic oncologist at the University of Kansas Cancer Center, and I'm sitting in today for Dr. Roy Jensen. Cancer treatment comes with side effects that vary with each patient, but the negative impact on sexuality is a constant and common concern. Some studies show that 100% of people diagnosed with cancer, regardless of the type or long-term prognosis, experience physical and emotional barriers at a time when they need human intimacy the most. But there's good news to share. There is hope. Joining me today are Dr. Danielle Staecker, an OB-GYN and pelvic pain specialist, and Dr. Kimberly Vandegeest-Wallace, a clinical psychologist who specializes in sexual health. Thank you so much for being here today. You know, patients going through cancer treatment are focused on survival, not necessarily how their sexual health may be affected by their treatment. But medications and surgery associated with cancer treatment, as well as the psychological aspects of experiencing a cancer diagnosis, can impact sexual health. Dr. Staecker, women who have survived certain cancers, as well as postmenopausal women, may experience declining estrogen levels that dramatically alter their sexual health. What side effects from cancer treatment can cause sexual problems?
So, surgically removing the ovaries, chemotherapy, radiation can all cause a woman to go into premature menopause. There are certain medications that we use, especially for estrogen-sensitive cancers, that even rob a woman of the estrogen she makes after menopause. And as a result, women can experience vaginal dryness, pain with sexual activity, bladder issues. They can also experience debilitating hot flashes, night sweats, difficulty sleeping, and mood disturbances, especially anxiety and depression.
Is it possible for these women who've had cancer to receive estrogen to relieve the side effects of cancer treatment?
So it depends on the type of cancer that they have. For most women who have an estrogen-sensitive cancer, estrogen may not be an option for them. But if the cancer is not estrogen sensitive, then estrogen certainly is an option for them.
If we can't give them estrogen, what can we do? There's got to be something we can do for these ladies.
Sure. First line are actually over-the-counter medications. This includes vaginal moisturizers and then vaginal lubricants. And there are some lubricants that are better than others for women in menopause. Another option is something called prosterone, which is a very low dose, not estrogen hormone, that is inserted vaginally and can also reverse a lot of the menopausal changes that happen in the vagina.
Well, I'm very thankful that there are some options for these women because it sounds awful.
It can be.
Yeah. Dr. Vandegeest-Wallace, do physicians typically discuss these potential issues with their cancer patients early on to prepare them for what they might experience because of cancer treatment? And if not, should they?
So the answer to your first question is no. And I'm going to break out of the role of Dr. Vandegeest-Wallace and just be Kim because I want to share my family story with you. So as a caretaker, my husband went through an 8-year battle with cancer. He was diagnosed with melanoma in 2007. And during that process, you know, imagine 8 years as an oncologist, right? We saw several specialists, and those specialists, and you two fill in the blanks if I forget some that you think I might have seen or we might have seen as a family, but we saw dermatologists, oncologists, ENTs, general surgeons, neurosurgeons, radiation oncology,
The butcher, the baker,
the candlestick maker,
everybody.
everybody, PTs, OTs, speech pathologists.
Yes.
We did it all.
Yeah.
And not one person brought up sexuality, sexual functioning, reproductive health. None of it. And we actually told them that we were experiencing secondary infertility and had been in the process of trying to expand our family for a year and a half.
I can't even imagine walking through cancer and fertility.
Yeah, well, I will
issues.
tell you that when we brought up the idea that we wanted to expand our family, we had one particular specialist tell us that's a variable I can't be concerned about. Right? I had another specialist that on the little wheelie chair, he literally wheeled into the corner when I asked him about my husband's sexual functioning. So it was clearly an uncomfortable topic to put on the table, even though it was vital to us. We had already decided whether Mark lived or died, that it was really important for us to have our older son, our firstborn, have a shared life experience. Both of us had siblings, and we knew how valuable it was to sit around Christmas dinner and look over at a sibling and make the crazy eye look like mom's doing that crazy thing again. And so when all of a sudden we thought our child may never have that experience, it was scary and painful.
If you could go back and have another one of those experiences with those providers, how would you have wanted them to introduce this to you and your husband?
Cancer, or how would I want them to address fertility?
Sexuality and fertility.
Yeah, I would have wanted them to be honest. I would not have wanted them to make me go do all the research on it and find the answers and the solutions. And I'm into sex, right? Like, this is my whole career. This is what I've dedicated my life to. So I knew how to do it. But I can't imagine, Dr. Spivak, if I didn't have that expertise and didn't know the path to take, how overwhelming it would have been. But just honesty would have been really cool, right?
Yeah, absolutely. What are some simple ways that I, as a provider, might bring this up with my patients?
Yeah. So I think there are ways from the very beginning of your encounter, even having it on your symptom checklist as people are telling you what's going on with them and what they're feeling and experiencing, pamphlets in the waiting room that say cancer and sexual health, so they have permission to ask you questions, being able to say to them, here are the chemo side effects, and don't skip the sexual ones.
Right.
Right. Just listing them and normalizing and saying this is the real experience.
When I'm thinking about why it's important for the patient as well as their partner to know what to anticipate related to sex after cancer treatment, I think about a lot of the concerns you're talking about. What else would you like people to know? What else should we explain to our patients or to providers to help patients anticipate what to expect?
Mm-hmm. Well, as someone who focuses on oncology, I would imagine you hear this frequently, that cancer is a very lonely process. Mm-hmm. When we are sexually connected, and when I use that term sexually, or when I talk about sexuality, I'm talking about sexuality. When you spoon and we hold each other, we hug and we touch and we hold hands, we shower together. Like, sexuality is extremely expansive. Cancer is lonely. Sexuality, all of it connects us, right? If we think about some of the more passionate moments of sexuality, when you talk to folks who are facing cancer and they talk about that lonely and they talk about fear, and they know that sometimes death is right here, do you hear those same words attached to sexuality? Or do you hear that it's a life-giving force, that it's a healing, that it's protective, that it's joining, that it's compassionate? Like, what a beautiful balance to have in the midst of a cancer process, and midst of on the path, right? To be able to say, I can balance this out.
When I think about the language that I might use, especially in my palliative care practice, I think about the language of intimacy, and often talk to my patients about where you are in your body right now. Intimacy might look different, but it's still important. Even in the process of dying, how you might offer someone touch, massage,
Yeah.
even witnessing,
Yes.
being next to someone.
Yes. I would push the call button and say, I need you to move him over at the hospice, right? I need you to move him over in the bed because I need to hold him.
Right.
I need to be close to him. I need to touch him.
So overall, maybe in summary, the big picture is that sexuality is important to talk about, bring up with our patients, and think about and keep reconnecting with throughout the cancer journey. It doesn't matter where you are, the beginning, middle, or end.
Absolutely.
Okay. And Dr. Staecker, what medical treatments do we offer our cancer patients who experience sexual issues following treatment? You talked a little bit about different management of vaginal lubricants, but what else, can we offer?
So we can offer them local estrogen therapy, and estrogen therapy comes as a cream, a vaginal tablet, or even a vaginal ring. I talked a little bit about prosterone, the non-estrogen option for them. A lot of women, when they're experiencing pain, end up with pelvic floor issues where their muscles can go into almost like a Charlie horse. And there are pelvic floor physical therapists who work with patients in order to reverse that. Another option for women, especially who can't use estrogen, would be something like the Mona Lisa treatment.
Tell me more about that. Yeah.
It's a laser treatment. It is painless. It is 3 sessions. Each session takes about 5 or 6 minutes, where we can reverse some of the menopausal changes within the vagina and restore healthy tissue.
Is that something that you can offer to our patients?
Yes, that's something that here at Kayuu we do offer to our patients.
And how do you determine which medical treatment will benefit which patients? How do you make that treatment plan?
I approach it with the type of cancer that they have and whether estrogen is an option or not, and then specifically what symptoms they're having. Because one patient may benefit more from pelvic floor physical therapy, another patient might need a little bit of estrogen cream.
It sounds to me like what's the most important thing is to see someone who's an expert in this area, to really have a thorough evaluation so that you're sensitive to and explore all of these different possibilities for why they might have sexual dysfunction, either physical or psychological or both. If you're just joining us, we're here with OB-GYN and pelvic pain specialist Dr. Danielle Staecker and clinical psychologist Dr. Kimberly Vandegeest-Wallace discussing sexual issues following cancer treatment. Remember to share this link with people you might think benefit from our discussion. Use the hashtag #BenchToBedside. Dr. Vandegeest-Wallace, often women who go through cancer also experience psychological and emotional challenges. Can you give us some examples of what women experience?
Yeah, I would say the biggest issue, and this is why some of those studies suggest that there is 100% effect of sexuality because of a cancer diagnosis, regardless of prognosis. So the biggest psychological impact is our identity shifts. So if you think about all the different ways in which cancer assaults us, whether it is our physical well-being, our faith, our roles in the family, I don't know that there's a part of our life that it doesn't touch. And when you think about that, and then you think about sexuality and how those two things intersect, sexuality for women, we literally are inviting our partner to be inside of us with their hands, their body parts, and that kind of intimacy, if we don't know who we are, we don't know who we are inviting them into, it is extremely threatening and too vulnerable.
So how can we empower women to feel comfortable discussing sex and intimacy issues with their clinician and also with their partners?
Mm-hmm. So I don't know that a lot of people are skilled at talking about sexuality. And so in an ideal world, we would see the clinicians start to model that and make room for it. show them how we do that and that it's absolutely okay. In my office, I talk about empowering through finding a voice. One of the things that cancer also does psychologically is it disregards us. So I think about disregard as being the thread that ties all forms of abuse, and cancer is abusive. So in my office, I'm so thoughtful about making sure the person in front of me feels regarded. So I'll coach people and say, if you were going to be regarded around sexuality, you go to talk to your oncologist. Let's talk about what that's going to look like, right? When your oncologist feels uncomfortable and doesn't want to answer that question, how will you bring them back to it? Right, so a regard, be seen, and know that that's okay to want that in this space with your oncologist.
I love that. I feel like I wish you were available to more of our patients to coach them and maybe share some advice on how to really bring this up with clinicians, and also for us clinicians to hear and be sensitive and respond in more appropriate ways. Dr. Staecker, how do you encourage your patients to talk about sexual issues they may be having following treatment?
So I also include it, like Dr. Vandegeest-Wallace does, as part of the questionnaire. But I'll ask open-ended questions. Are there any issues with your sexual intimacy? Are you experiencing any pain?
And for both of you, Dr. Staecker and Dr. Vandegeest-Wallace, what would you most like our listeners to walk away with today?
So at Kayuu, we approach sexual wellness as a team approach with the oncologist, sex therapist, gynecologist, physical therapists, and with that team, we can best empower and help women live their lives better.
I love it.
For me, the first thing that comes to my mind is hope. I want to give out hope like a Pez dispenser. You know? Like there's so many moments in the trenches with cancer that hope gets kicked in the butt, and
Absolutely.
I want my space to be a place where they can be lifted back up and realize that there is reason to be hopeful.
I love that. I also want to echo back to the beginning and your story, and thank you so much for sharing your story with your husband, is that sexuality, sexual health issues during cancer don't just affect women, that this is a problem for men as well, and that this is a topic that we would invite everyone to explore with patients, and for patients to ask their providers about, regardless of their gender, right?
Yeah.
And sexuality. So thank you so much. Well, that's it for today. To learn more, please visit kayucancercenter.org/women's health. Join us next time as Bench to Bedside explores Kayuu Cancer Center's telehospice project. Thanks for watching.